Hello guys, my name is Giovanni Kalika, and today I'm going to talk about substance use disorder. In this presentation, we are going to cover what are the causes of substance use disorder, what are the effects on an individual's life and ability to function, what are the health issues, and what are the treatments that can be used to prevent substance use abuse. Let's jump right to it. What is substance use abuse, substance use disorder? Substance use disorder, commonly called SUD, is a serious issue where people can't stop using a substance even when it's causing them harm. They become more obsessed with using substances like alcohol, drugs, or tobacco, which affect the ability to function in their daily life. It is often called addiction when it becomes too severe. How common is SUD? Nearly 1 in 3 adults in the United States, which is approximately 33% of adults, had a substance use disorder in the past year, and 46% of young adults between the age of 18 to 25 had a substance use disorder. Right below, we have the charts of the most commonly used substances in the United States in the past year. As we can see, alcohol and cannabis have the highest percentages among all those other substances. Here are some more statistics. Among Americans aged 12 years and older, 37.309 million were current illegal drugs users used within the last 30 days as of 2020. 13.5% of Americans 12 years and older used drugs in the last month, a 3.8% increase year over year. 59.277 million, or 21.4% of people who have over used illegal drugs or misused prescription drugs within the last year. 138.543 million, or 50% of people aged 12 and over, have illicitly used drugs in the last time. Usership among people aged 12 and over is down by 0.4% year over year. 138.522 million 12 Americans 12 and over drink alcohol. 28.320 million, or 20.4% of them have an alcohol use disorder. 57.277 million people use tobaccos or nicotine products like vape. 25.4% of illegal drugs users have a drug disorder. 24.7% of those with drug disorder have an opioid disorder. These include prescriptions, pain reliever, or painkiller, or heroin. So what are the causes of SUDs? Substance use disorder is caused by a combination of different factors, such as things happening in a person's environment that can cause stress, pressure from friends or society to use substances, a person's individual and individual personality trait, and any other mental health issue that they may have. It is really important to note that the specific factor that has the greatest impact can vary from person to person, and it's not the same for everyone. What are the impacts on a person? SUD changes the way people think and behave because it affects the brain. It creates intense craving, alters their personality, and can cause strange movement and behavior. Studies have shown that it changes the structure and function of certain parts of the brain that control things like decision making, memory, and behavior. These changes can last even after immediate effects of using uh, the substance wear off. Symptom of SUDs. What are the symptoms of SUDs? The symptoms of SUDs can be grouped into four categories: impaired control, which includes strong craving and failed attempt to cut out or control substance use; social problems, which include difficulties in completing important tasks and giving up activities due to the substance use; risky use, which include using substances in dangerous situations and continuing using continuing to use it despite knowing the risks; drug effect, which could building up tolerance and experiencing withdrawal symptoms when stopping. What are the effects on a social life? People with SUDs may want to quit, but they find it difficult. It can cause physical and mental health problems and strain relationship with families, friends, and work. Alcohol, drugs, Alcohol and drugs use are major cause of preventable illnesses and early death. How to treat SUDs? Treatment for SUDs involve recognizing the problem and seeking help by a healthcare professional, and the healthcare professional will assess the symptoms and determine the best course of actions in order to prevent or to stop the substance use disorder. Treatment usually involves a combination of medication, therapy, addressing the individual needs, and any other problems that they may have. Medication can also help control craving and withdrawal symptoms, while therapy helps with understanding behaviors and developing coping skills. Treatment plans can vary from person to person and may include hospitalization, out, outpatient programs, and support groups like Anonymous, Alcoholic Anonymous. Ongoing support. Ongoing support is crucial for long-term recovery. What can you do to help? If you want to help someone with SUD, educate yourself about addiction and offer your support. Express your concern and offer to go with them for help. Avoid argument. Don't cover up their behavior and don't blame yourself. Recovery is a process, and ongoing support is important for the long-term success. Um, Thank you for listening and taking the time to listen to my presentation.